Hello, I'm Judy French, Director of the Ohio Department of Insurance. We're so happy that you could join us today for this virtual Medicare town hall to help kick off our upcoming Welcome to Medicare events around the state. Today, you're going to hear from Chris Regg. She's the Director of the Ohio Senior Health Insurance Information Program, or SHIP, or OSHIP, as we like to say. She's going to walk you through Medicare coverage options, financial assistance, and important deadlines. If she doesn't cover a topic that you'd like to hear about today, not to worry. We've got lots of information on our website, insurance.ohio.gov, and we have a schedule of a variety of events of our Welcome to Medicare in-person and virtual event dates around the state. Before we jump into it, I want to tell you a little bit about the Ohio Senior Health Insurance Information Program. OSHIP is a nationally recognized Medicare information program that has counseled more than 1.25 million people and saved Ohioans more than $226 million since 2012. Program's mission is to provide free and objective health insurance information to Ohioans who are nearing the Medicare eligibility age of 65, their beneficiaries, and their caregivers. They do this through a variety of methods: telephone hotline, one-on-one counseling, year-round in-person and virtual outreach events, and a variety of informational webinars like this one. So I want to say thank you for joining us today as we kick off our statewide Welcome to Medicare events. I'm confident you'll find this town hall and any upcoming virtual or in-person events you choose to attend helpful, informational, and a valuable way to spend an hour of your day with us. And with that, I'm going to hand it over to Chris.
Thank you, Director French, for a wonderful opening. Again, my name is Chris Regg. I am the Program Director for OSHIP, the program at the Department of Insurance to provide objective, unbiased information about Medicare and all related topics. Thank you so much for joining us today and taking the time out of your schedule to hear about this very important information. Today, we're going to hit on a lot of the highlights for those that are getting ready or approaching the Medicare benefit. So without further ado, let's talk about Medicare. First of all, what is Medicare? Well, Medicare is health insurance, plain and simple. It's health insurance that's provided by the federal government for individuals at age 65 or older, any age, if collecting Social Security or railroad disability, typically after a 2-year wait period, and individuals with permanent kidney failure or end-stage renal disease. So those are the 3 groups of individuals that are eligible for Medicare. Once you're on Medicare, the options really look the same. And I often laugh, this demographic that we have up here was actually created back in 1999 when Medicare Plus Choice came about, which is now known as Medicare Advantage. So our goal today is to go over these 2 options that Medicare beneficiaries have when they're on the Medicare program. Option 1 that we'll talk about is Original Medicare, Part A, which is hospitalization, and Part B, which is medical. That's your red, white, and blue card. Original Medicare pays the majority of medically necessary services for beneficiaries, but not everything. Individuals that choose to stay on Original Medicare as their primary health insurance often have secondary insurance or a second insurance card in their wallet to help pick up the costs that Medicare, Original Medicare, does not pay for. We'll talk briefly that some folks have group health insurance, perhaps from a company that they or a spouse retired from. Many search for private insurance that pays second to Medicare, known as MedSup, Medicare Supplement, or Medigap. Some qualify for Medicaid. Medicaid is state assistance for individuals with limited income and limited resources that can also help pay the out-of-pocket costs after Medicare. If you're in option 1, there's often a third card in your wallet for prescription drug benefits, otherwise known as Medicare Part D. We'll cover those topics. The alternative to option 1 is option 2, Medicare Advantage, now known as Medicare Part C, and that C is for choice. As a Medicare beneficiary, you can choose to receive all your Medicare benefits from a private health insurance company. These are typically managed care plans that use a network of doctors and hospitals and providers to get the most benefit from your plan. It includes your Part A benefits, hospitalization, your Part B benefits, medical coverage, and typically it includes the prescription drug coverage. So you have one card in your wallet for all your healthcare and prescription needs. Let's break down these options. But first, how do you get Medicare? You have to apply. Now, some individuals that are aging on to Medicare don't have to do anything. If you are already collecting Social Security income, retirement benefits, or railroad retirement benefits, they know when you turn 65, and the red, white, and blue Medicare A and B card will arrive automatically. Also, if you're receiving Social Security disability income, they know when the 2-year wait is over, and you will receive your card automatically. Everyone else must apply. So if you're not collecting any Social Security income, or perhaps you've been diagnosed with end-stage renal failure, you have to apply through Social Security. And we'll hit on this a couple times, but the easiest way to do that is through their website, socialsecurity.gov, to enroll in your benefits. Briefly, let's talk for those that are turning 65. If you're not collecting any Social Security, you will have a 7-month initial enrollment window. It's the 3 months prior to your 65th birth month, the month of, and the month after, or 3 months after. Now, the moral of the story is we want folks to apply for their benefit during the 3 months before that 65th birth month, so that their Medicare benefits begin the first day of their birth month. A quick example, if my 65th birthday is in June, I am already in my initial enrollment period. I have March, April, and May to apply for my Medicare, and my coverage will start June 1st, regardless of my date of birth. If I wait until June, the month of, it starts a month later. If I wait till those 3 months past my birth month, it's 2 and 3 months later. So please, if you're not receiving your Medicare benefit automatically, be as proactive as possible in signing up for Medicare in that 3-month window before your birthday. Now, when we start our Welcome to Medicare campaign, the #1 question that we are asked is, what if I'm still working? What if I'm still working when I turn 65? Do I have to take Medicare? And the answer to that question is you generally want to go ahead and sign up for Medicare Part A, the hospital benefit. Medicare Part A is based on entitlement. And as long as you or your spouse have paid into the Medicare program for 10 years, Medicare Part A is premium free. Medicare Part B, however, you enroll, and the current monthly premium is about $170 per month. So if you are covered by current group health coverage from you or your spouse's employment, you can delay taking the Medicare Part B. Now there's a note, COBRA is not current group health coverage. COBRA is a law. It means you're not working, but you have the right to extend that group health coverage at your own cost. You're not currently working, COBRA would not be a delay that would qualify you to enroll during a special enrollment period. So again, I want to repeat because this comes up so often. If you are currently working and your current employer provides group health coverage, you may delay taking Part B. If you are married and your spouse's current employer provides you with health care coverage, you can delay taking the Medicare Part B. Now, when you or your spouse decides it's time to retire, quit, walk off that job, whatever, you will have a special 8-month enrollment window. So if I know I've got this great coverage, I'm turning 70, I'm going to retire in April, be proactive. Again, don't wait until that 8-month period. Go the month before. Go in March and get your Medicare Part B. But you do have an 8-month special enrollment that begins the month after your current coverage ends. So the reason that's important, a lot of folks have heard that there is a Part B penalty, and that's true. If I'm turning 65 and I say $170 a month, oh my gosh, I don't want that. I'm healthy. And I delay taking Part B. Then I would be able to sign up every year during a general enrollment period. My coverage would not start until July 1st, and I would face a penalty of 10% of the premium for every year that I delayed taking the Part B. The one and only exception to that penalty is if you or your spouse are covered by current group health care coverage. So I know we're hitting high level things today, and there'll be multiple opportunities to get more information later, but this is a very popular topic, so I wanted to spend just a moment on that. Let's go back to talking about Medicare. We mentioned those two different options, and option one being original Medicare. And there's a look at the new Medicare card. It'll have your name on it. It has your Medicare number. Your Medicare number is no longer your Social Security number. It's an 11-digit identifier. We ask that you keep that near and dear. Protect that number at all costs. The reason they switched from Social Security numbers was to help cut back on fraud. So what I like to share with individuals as they're getting this card is protect it from the very beginning. Fraudsters don't have your number. Let's keep it that way. Only share it with your providers when you're seeking service. But Medicare is Part A and Part B, and I mentioned before that Part A is hospital. It actually covers all inpatient stays. So if you're admitted inpatient for the hospital, it's a Part A covered stay. If you need inpatient skilled nursing care following a hospitalization, that is a Medicare Part A benefit. Medicare Part A also covers home health care. If you are homebound and couldn't otherwise get out for medically needed services, home health care is available. And hospice, the pain relief and symptom management for those that are terminally ill. Medicare Part B is your medical benefit. It covers all outpatient services. So every doctor, provider, those are all Part B services. And Part B has been extended over the recent years to include more preventive benefits, including a welcome to Medicare physical. Within that first year of having Medicare Part B, we encourage you to take advantage of the full physical. And each year after that, a wellness check with your provider. Medicare Part B also covers medically necessary durable medical equipment. Few notes, Medicare was never intended to pay 100% of the cost for Medicare beneficiaries. So we'll look at the out-of-pocket cost momentarily. Also, there are things Medicare does not pay for. Medicare does not cover anything that's not medically necessary, such as cosmetic or elective type surgeries. Original Medicare does not have a dental benefit. It will only cover medically necessary services for eyes and other things. You're also not covered when you travel outside of the United States. So if you travel abroad, look for a travel policy, or your private insurance might have some benefits. All right, so we know original Medicare Part A and B work together to cover the majority of your healthcare costs, but not all. Let's break down the out-of-pocket costs should you only have original Medicare. We mentioned Part A is generally premium free for those who have paid into the Medicare tax for 10 years or under a spouse's record. But there are costs. For example, the hospital deductible for 2022 is over $1,500. That hospital deductible is not an annual deductible. It's based on a benefit period. So if I'm on Medicare and I am admitted to the hospital, I would be responsible for that $1,500 deductible. If I go home from the hospital, home from inpatient care for more than 60 days, if I'm admitted again, I would again be responsible for that deductible. I highlight that because a lot of folks feel that once they get their red, white, and blue card, that's all they need. And it is comprehensive coverage. But if original Medicare is your only form of health insurance, you would be responsible for all these costs out of pocket. Typically, once you meet your deductible at the hospital, most days are covered at 100%. You can see that days 1 through 60. But if you get to extended days in the hospital within that benefit period, those copays can go up greatly. Days 61 through 90, $389 per day. Days 91 to 150, $778 per day. And while we rarely see individuals have that long of an extended stay in the hospital, they are potential out-of-pocket costs. What's more common is after that inpatient hospital stay to be admitted for skilled nursing care. Medicare will cover the inpatient skilled care. The first 20 days are covered at 100%. Days 21 through 100, $194.50 per day is the patient responsibility. And to remember, Medicare is there for medically necessary services. If the skilled facility feels you have plateaued or you are no longer benefiting from that care, your care will be cut short. They'll give you notice that it's time to go home. The average stay at a nursing facility is about 3 weeks. Now, Medicare Part B works a little bit differently. First and foremost, everyone on Medicare Part B pays a premium. Generally speaking, most will pay $170.10 every month for Part B. It is typically deducted from the Social Security check. Now, if you have a much higher income, you could pay a higher monthly premium for Medicare Part B. Also, we had mentioned that late enrollment penalty, which could add 10% for each year that you delay. So everybody's paying a premium for Medicare Part B. When you use the Medicare Part B, all those outpatient and provider services, you have a $233 annual deductible. That is the patient's responsibility. Then Medicare has an allowed amount for all services, and the patient is generally responsible for 20% of the Medicare approved amount, Part B paying the other 80%. So a few notes. Again, the reason we go through these out-of-pocket costs, if you just had Medicare, this is what you would have to pay out of pocket. It does show the need for secondary coverage. Secondly, it does encourage you here to sign up for your personal account at medicare.gov. It's called a My Medicare account, where you can view all of your statements, your costs online before receiving any of those, of the explanation of benefits. The other thing we'll mention briefly here in secondary coverage, there is help. If individuals are struggling with monthly income or resources, there are programs to help pay these out-of-pocket costs. So let's talk about the secondary insurance, things that help pick up those costs that Medicare does not cover. First of all is group health insurance. It used to be more common, it's a bit rare today, that an employer provides healthcare coverage to you as a retiree once you are eligible for Medicare. If you have access to group health insurance, I would encourage that to be your first stop. Talk to the benefit planners about how your benefits will work once you're on Medicare. Generally speaking, if you leave your group health insurance for private insurance, they don't have to let you back in. So always check with your employer to see if there are benefits available to you or your spouse as a retiree. Second is Medicaid. Mentioned a few times, individuals with limited income and resources may qualify for assistance. Those programs are like a ladder. The most destitute will get the most assistance. If you have a little more income, a little more resources, it may pay less. For example, there are some programs that simply pay the Medicare Part B premium. If you know of someone that is struggling to pay the cost for their health care, I highly encourage you to reach out to us to inquire about these programs. Enrollment is handled by Medicaid through your county job and family service office. And I guess the motto is, when in doubt, fill it out. The worst case scenario, they'll tell you you have too much to qualify for this help. But in many cases, individuals qualify for assistance that can save them thousands of dollars each year. Finally, with regards to secondary insurance, we'll touch on Medicare supplement insurance. Now, this one could be a 4-hour discussion all by itself, but Medicare supplement insurance, or MedSup, Medigap, it's all the same thing. This is private insurance that pays after Medicare Part A and Part B, and only after Medicare Part A and Part B. This is not an Advantage plan. One of the biggest misconceptions that we see, and nationally, is individuals confuse supplement insurance with Medicare Advantage plans. So remember, supplements are private insurance policies that you can purchase to pay after original Medicare. Advantage plans that we'll touch on shortly replace Medicare and the supplement. Two completely different products. With Medicare supplemental insurance, if you're interested in staying in that option, we do advise you start doing research. You can contact OSHIP. We can do a personalized search of what premiums are likely to look like with the companies that sell within the state of Ohio. These plans are standardized. So we like letters. They're labeled, plans A through N, but they're standardized. So if you're shopping for a plan F, like Frank, it's the same benefit package from every single company. So then you can shop strictly based on the benefits that you want in that policy. One last thing that I would like to stress with supplemental insurance is that you do have an initial enrollment window for MedSup as well. You have a 6-month open enrollment from the time your Part B starts to make application for any supplement sold in our state, and you must be sold the policy. No medical underwriting. Outside of that open enrollment window, Medicare supplement companies can medically underwrite the policy, and they may not sell based on your application. Now, there's always, little nuances. If you're in a situation where you lose healthcare coverage through no fault of your own, maybe the group plan ends, and maybe the Advantage plan leaves the state, you would have protection to purchase these supplemental plans if needed. But generally, the best time to shop for those policies is during that 6-month initial open enrollment window. All right, we're still covering our boxes. So far, we've talked about original Medicare, highlighting the out-of-pocket costs. We've talked briefly about secondary insurance to help pay those out-of-pocket costs. The third card in the wallet that we're going to discuss is prescription drug coverage. And you'll notice we say Part D or group health insurance. Again, some folks are very fortunate to have access to prescription drug coverage that is equal or better than what Medicare is offering, perhaps through the VA, an employer, or other benefits. And you don't need Part D. But the majority of the Medicare patients that we speak with, their only access to prescription drug coverage is looking at Medicare Part D plans in our state. So there's 2 ways to get your Medicare Part D. One is through a standalone prescription drug plan. That's for individuals who have original Medicare, a supplement, and then the standalone Part D plan. They always have about 30 of those to choose from, and we'll talk in a moment how to best choose those plans. It is also available through Medicare Advantage plans. If you select option 2 and join a Medicare Advantage plan, the drug benefit, Part D, is often part of that benefit. So the initial enrollment for Part D is identical to Part B. Kind of easy to remember. When you're ready for B, take the D. So you can enroll during that same time frame. After that, this is a little different for folks. Every single year from October 15th to December 7th is the Medicare open enrollment. At minimum, we ask that you review your prescription drug plan. Medicare Part D plans are contracted with the federal government, Medicare, and their contract is 1 year. So even if your prescription drugs do not change, the plan might. And we want to make sure that you choose the best prescription drug plan for your needs each year. The 3 things that we're looking for is cost, coverage, and convenience. What we typically do is we go to medicare.gov and they have a plan finder tool. We're able to enter your specific medications to determine which of the plans in Ohio would be the most cost-effective and cover your medications. Coverage refers to the formulary. We want to make sure your medications are on the formulary covered by that plan. And convenience is knowing which pharmacies are in network. Often there are preferred pharmacies that would allow you to get the best benefit and lowest costs for your prescription drugs. I should mention many also offer the mail order option, allowing you to get a 90-day supply through a mail order, and many of the local pharmacies will offer that 90-day supply also. So far it seems like we've talked a lot about option 1, original Medicare, secondary insurance, Medicare Part D. Well, that's really laid the foundation for Medicare Advantage plans. Medicare Advantage plans are the alternative to those 3 cards in your wallet. And Medicare Advantage plans, at minimum, have to cover what original Medicare would have paid for. So it's replacing the need. You're either in original Medicare or the Medicare Advantage plan. Medicare Advantage is available really to anybody that has Medicare Part A and B and lives within the plan's service area. There are no age or medical restrictions, so there's no medical underwriting to join a Medicare Advantage plan. I can't stress this enough. It's an alternative to original Medicare. This is not a supplement. It's not paying after original Medicare. By joining the Medicare Advantage plan, you're agreeing to all the terms of their healthcare coverage. We mentioned they are managed care. The vast majority are either health maintenance organizations. These are plans where you must use network providers in order for the plan to pay. Some are preferred provider organizations. They prefer you use their providers, and if so, you have lower out-of-pocket costs. Many of these plans are listed as MAPD. That means Medicare Advantage with the prescription drug benefit. So if you need Medicare Part D, you would have to get it from that Advantage plan. You couldn't enroll in an Advantage plan and then choose a separate standalone drug option if the drug plan is available from the Advantage plan. Now, most of these plans, well, first and foremost, I should say you're going to pay your Part B premium. That $170 is still coming out of your Social Security check. However, one of the added benefits some of these Advantage plans are offering is help with that premium. Typically not the full $170, but they're working with Social Security and may lessen the amount that you pay for Part B. After that, you really have to look at each one of these Medicare Advantage plans individually because they all have a different cost sharing. Some have additional premium that you would pay in addition to Part B. Some of them, few, have deductibles that must be met. And then the co-pays. So while they may not have any additional premium, they do have co-pays that you're responsible to pay. An example would be maybe a $20 office visit copay or a $50 urgent care copay. And those are just examples. We have some counties in the state of Ohio that have more than 90 Medicare Advantage plan options to choose from, and that can be overwhelming. So again, I highly encourage you, take advantage of OSHIP. We've got more webinars, we've got in-person events coming up, but we also do one-on-one counseling, both in person, virtually, and through our toll-free number. We don't want the welcome to Medicare to become overwhelming. We can help point out the pros, the cons, the good, the bad, the ugly about the plan, so you can make an educated decision when it comes to your healthcare benefits. I mentioned this was a high level. We hit on a lot of topics that individually could have been sessions all on their own. So before we jump to questions, I want to reiterate, OSHIP is here to provide that objective information. If you're aging on to Medicare, your mailbox is likely full of advertisements. How do you sort through that? Your email is likely just bombarded with marketing material. It's even through text messages now. So I highly encourage you to set all that marketing aside. Do not choose your health and drug plan based on the pretty marketing package. Base it on your individual needs for your health care, your providers, the networks, and the prescription drugs that you need. And OSHA can help individualize that before you talk to any of the companies or the plans. We are going to be offering lengthier webinars bi-weekly for the remainder of the year. We are going to be hosting a lot of in-person Welcome to Medicare events that I hope if there's one near you, you're able to take advantage of. We offer one-on-one counseling on a virtual platform that you can sign up for via our website, insurance.ohio.gov. And of course, our 800 number. And I joke, you see an 800 number especially, you probably picture this vast call center. We actually have about 10 individuals here in Columbus, Ohio, and thankfully with a lot of longevity and knowledge about Medicare that you can talk to one-on-one. We're available Monday through Friday, 7:30 a.m. to 5 o'clock p.m. If you're an early riser, I highly encourage you to call in the morning. That's typically when our phone lines are light before we get going into the day. A few other partners I want to point out, one that is not listed in front of you, but included in the Medicare booklet that Becky has shared, and that's Pro Seniors. They are Ohio's senior Medicare patrol. Unfortunately, Medicare, it's huge, largest healthcare in the country. It's prone for a lot of folks to try and fraud. Unfortunately, anytime there's a change with Medicare, anything that could cause confusion amongst Medicare patients, unscrupulous individuals will try to take advantage. I mentioned that you need to protect your Medicare number, but also protect your credit card and payment methods. If you question anything, please do not give out personal information. Medicare is not calling you directly. If someone contacts you and is trying to extrapolate personal information, I'll use their term, it's shrewd to be rude. Hang up and go to the proper number for the Medicare agencies. And that being Medicare is simple, 1-800-MEDICARE. And they also have a vast website, medicare.gov, where we can do those plan comparisons. You can also set up your My Medicare account so you can view all your claims online. And Social Security, they are the gatekeeper to Medicare. The enrollments must be done through Social Security. We are anticipating their offices to open at minimum capacity in the month of April. Their toll-free number is there. They're busy, they're backed up. If at all possible and you have access to the internet, use socialsecurity.gov to enroll in your Medicare benefits. That way there's no wait and things are handled in a more streamlined manner. So with that, Becky, do we have any questions?
So just some people have found the question pane here. So if you do have questions, feel free to type them in or comments. And then you did point out the handouts as well, and those are also in the dashboard there. So Chris's presentation that she shared today is there, and we have something we call our Medicare 101 handbook that is there as well. So those are 2 PDF documents that when you click on, they'll open in a separate link. You'll want to make sure that you save it, because when we close out this webinar, it is over and you will lose those documents. So Chris, you mentioned Pro Seniors as well. I'll get to the question. Sorry, want to remind folks that we are hosting Pro Seniors for a Medicare Fraud Hot Topics webinar on May 12th at 2 p.m. So I hope you'll join us again to learn more about that, because that is such an important information there, the fraud hot topics that are out there, and then just recycle, right? So you talked about the OSHIP hotline. How does it actually work? What happens when I call the hotline?
As mentioned, you're actually talking to somebody not just in the United States, but right here in Ohio. And we've got 10 individuals, our insurance complaint analysts, that are answering those phone lines. And really, it's any Medicare questions. You know, sometimes we get some simple questions about, you know, what's the premium this year, to extremely in-depth cases. And our analysts also have access directly to the Medicare complaint tracking modules. So if in the future you're in a Medicare regulated plan, we can file those complaints on your behalf for Advantage plans and prescription drug plans. I also want to point out, you know, because our department, we get a lot of provider complaints for Medicare. And just to reiterate, Medicare is a federal program. So the federal government is regulating the oversight of original Medicare using a Medicare Administrative Contract, or CGS, for Ohio. Medicare is contracting Part D and Advantage plans to these private companies, and those are regulated federally. So we have to get those complaints to the federal government. Really, the state regulation is with Medicare supplement insurance, those private policies that pay second to original Medicare, and those are handled in-house by our Consumer Services Division.
Great. So here's a question that kind of goes with that. Do you have to go through an agent to purchase the supplement or the Advantage plans? And then what is the best way to make sure we get unbiased advice?
Yeah, it's a lot to digest, especially when you're new to Medicare with all those advertisements coming. If you're on original Medicare and you want to shop for a supplement, OSHIP can help narrow it down. We do have a web-based tool that will allow us to provide premium quotes. But with supplemental insurance, you would contact the company or an agent to purchase that private insurance directly through them. When it comes to Medicare Advantage and Medicare Part D plans, you can enroll yourself on Medicare.gov. Once you've done the comparison, there is an enrollment option. OSHIP is here to help with that. I always say we're your fingers on the keyboard. If you're not comfortable manipulating the Medicare.gov website, we will navigate it for you. We will share everything in the process. And then if you choose to make an enrollment, we can also be your fingers. With Medicare Advantage plans, I encouraged a couple times to be proactive. Ideally, you're not making that enrollment on that first call. You may have providers that you are not willing to give up. I always encourage you to contact the provider, usually the billing office, and just ask if they are in network with that plan and, you know, planning to stay. There's no guarantees. Employer contracts with these Advantage plans are often 1 year, and they don't coincide with the open enrollment period. So just be cautious that if you're joining a Medicare Advantage plan, you have to use their network providers. And if those change mid-year, you may have to find a different provider. Fortunately, we don't see that very often. There's typically resolution if those contracts come up, but we want folks to be aware of everything before they sign up for the plan.
Okay, I've had this, someone's asked me this before, and I'm always concerned what number they're calling. When people call into Medicare, is Medicare supposed to transfer people to an insurance agent?
Absolutely not. Thank you for bringing that up. We've seen the ads on TV. Often, you know, you've got your retired sports icon or another famous actor, and it looks very governmental. It looks very official. They're lead agencies. If you're not calling 1-800-Medicare or Social Security's toll-free number, you are highly likely calling a lead agency. So essentially what that's going to do is transfer you to an out-of-state broker firm, usually in Florida or Texas, and they are going to try and sell you a product because they are making a commission off that. What I find more harmful is that now you as the individual have made first contact. So these insurance companies are now prohibited. They are not prohibited, I'm sorry, they're now permitted to reach out to you. And you've likely just signed yourself up for a lifetime of spam calls. And it's very hard to put an end to it. We work very closely with the Senior Medicare Patrol Pro Seniors that I mentioned. In fact, just last week, I did a panel discussion with them, the FBI, the Office of the Inspector General, the Attorney General, and it's illuminating. But anytime there's a change, fraudsters will try to take advantage. So please, at all times, know who you're calling. Do not call the number based on an ad on TV.
So this has come up a couple times, folks who are still working, and if they do take Medicare, either A or B, what happens? How does Medicare work with your active employer health insurance if you do go on Medicare A or go on
Yeah,
Medicare A?
good question. Thank you for bringing that up. If I'm still working at the age of 65 and I take the Medicare Part A because I'm entitled to it, it is generally going to be secondary to my group healthcare coverage. So as long as my employer has more than 100 employees under their big umbrella, or 20 if I'm disabled, Medicare is going to be secondary. And likely the employer plan pays more than what Part A would have, so it usually sits dormant. Same thing with Part B if somebody happened to go ahead and pick up that Part B benefit. Then when I decide I'm going to retire, it's going to flip. My Medicare would then become my primary health insurance. If they offer group health coverage, that's typically secondary, or they may put me into a retirement Medicare Advantage plan underneath my group umbrella. You know, so many different scenarios, and OSHIP's here to help walk you through that to see what your individual situation needs.
Can you explain a little bit what is the late enrollment penalty for both B and D?
And D, yeah. Hopefully we get enough education and information out there that folks don't find themselves in this situation. But let's start with Part B. Let's say I am healthy as can be, and I am turning 65, and I just don't want to pay $170 a month for Part B. So phooey, I skip enrolling. 5 years goes by. My health is starting to decline, and I think, ugh, I better get that medical coverage. I probably should go see a doctor. Well, I can enroll in Medicare Part B during January, February, or March, general enrollment. I won't have coverage until July. So first, they're making me wait. Second, they're going to hit me in the pocketbook. For every year that I delayed, I'm going to pay a 10% penalty. So I think I said 5 years. That's 50% on top of the current Part B premium. So we want to avoid that at all costs. And we typically don't see that. Individuals, again, who are covered by current group health coverage under their own employment or their spouse, that's an exception to that penalty. Medicare Part D, and I did not state this earlier. If you do not take Medicare Part D when you are first eligible and you enroll later, which any year, October 15th to December 7th, coverage will start in January, I'll be assessed a 1% penalty for every month of delay, or a 12% penalty for every year. However, larger exception to that, if you have any drug coverage that is equal to or better than what Medicare Part D is offering, and you sign up late because of loss, one, you'll have a special enrollment, no wait, and no penalty. The other thing I want to point out with the Medicare Part D that we didn't mention is there's also extra help. We talked about Medicaid for those that are limited income, limited resources. If you're still struggling to pay for your prescription drug coverages, you may qualify for extra help with just the Part D expenses. And that application is done on Social Security's website. OSHIP can assist with that application. But when in doubt, fill it out. It'll help pay those costs. And then if hopefully not, you were in a situation with a penalty, that can alleviate some of the hindrance.
So is it usually better to stay on your employer's insurance if you are still working at 65, or to go on Medicare?
Very generally speaking, yes. The employer coverage is typically very comprehensive at a low cost to you because of the current employment. We've seen some where it may not be as beneficial for the spouse to remain on, depending on what their spousal coverage looks like. And in some rare instances, especially if it's a very small self-insured group, where it is beneficial to go ahead and take Medicare. So kind of the overwhelming theme of today's talk is it comes down to your individual situation, your individual needs. There's no blanket answer, especially for group health coverage. You have to know the specifics of that group. And our goal throughout all this is just to provide the outreach and education so you make those wise decisions and use us as a resource along the way.
So if I am still working and I have that 7-month initial enrollment period, what exactly would I need to do during that initial enrollment period?
Typically, if you're currently working and you're covered by group health coverage or your spouse is working, you simply during that time frame need to pick up Medicare Part A. Use socialsecurity.gov. It allows you to just enroll in Medicare Part A. And if they haven't changed it, the very last thing is a part where you can leave a note. I usually encourage, I don't know if this is helpful or not, but I put a note, I'm currently working, I have group health coverage from my current employer, I'm only signing up for Part A. And that's probably more peace of mind for me, but just an added suggestion.
And you don't have to do anything either, so you don't have to take A.
You don't have to, but you're entitled. Go ahead and take A, and then when you decide to retire, you can simply pick up the B.
So I'm going to open a can of worms. Who would not take A?
You might have to walk me along. It's been a while since we've had that question. Oh, HRA is where you're going. Apologies.
Health savings account. Health savings account.
All right, yeah, Becky is opening up a big can of worms. So it's very common that if you're working, you have the access to pay into a health savings account. So money that you can use tax-free for your healthcare services. Most employers, you can't carry it over from year to year. It has to be used within that year. Well, there's a tricky little situation with HSAs and Medicare, and that's you can't contribute to a health savings account and have Medicare Part A. So there's some timing involved. You want to make sure that you have halted your health savings account payments prior to signing up for Medicare Part A. And you know, this is a tax law. It's an IRS revenue thing. You can always work with your human resource office to make sure you stop those payments in time for your Part A. But thank you for bringing that up because many individuals working are paying into those accounts. You want to make sure you stop the payments into the HSA before Part A comes about. Now, once you get Part A, if you have money sitting there, you can use it. You're not going to lose that, but you want to stop contributions before Part A.
All right, so does Medicare cover hearing aids or dental?
Yeah, we mentioned briefly things that Medicare does not pay for. Medicare currently does not have a dental benefit. If you're in need of those services, you can look for other discount policies. Medicare Advantage plans can offer added benefits, and vision, dental, and hearing are the most common. So I guess the easiest way to answer that question is Medicare, again, is there for medically necessary services. So if you have a disease of the eye or, an illness that they are treating, those types of things are going to be covered. But what we typically think of is going in for hearing loss and hearing aids. That's not covered. Going in for a routine vision exam to see if you're still 20/20 is not covered. Eyeglasses or contact lenses for correction is not covered. Medicare will only cover eyeglasses following cataract surgery. So huge limitations on vision, dental, and hearing. Again, that's another enticement to the Advantage plans. They often cover benefits beyond what Medicare covers. I really encourage you, though, choose your healthcare benefits for just that, the health insurance, and then those added benefits. Hearing, vision, dental, gym memberships are an added benefit.
I did open a can of worms. Okay. Can I switch from Medigap plans to Medicare Advantage plans?
Yeah, so going back, that's again, we come into all these different Medicare enrollment periods, and sometimes just understanding that is a lot to digest. So during your initial enrollment, ideally you're getting all this information prior to joining Medicare. You're going to make, the best decision for you, and hopefully that plan will last at least for the rest of the calendar year. There are a multitude of enrollment opportunities and special enrollment opportunities that you may be able to take advantage of. A couple for those that are new to Medicare. If you join a Medicare Advantage plan and it's your first time ever in a Medicare Advantage plan, you do have a 12-month trial right. At any time during that first year, you can go back to original Medicare and you would have guaranteed issue for supplemental insurance. Outside of that, every year during the general fall open enrollment, October 15th to December 7th, and boy, you're going to get hit with a lot of marketing material then, you can change from original Medicare to the Advantage plan. You can make application for a supplement anytime, but remember, those are medically underwritten and not always guaranteed to be issued. The flip-flop of that, you can always go from original Medicare and a supplement to an Advantage plan during the fall open enrollment without medical underwriting. I hate to get too deep into this, but there's also a Medicare Advantage open enrollment period every January, February, and March, where if you're in an Advantage plan, you could choose to go back to original Medicare or choose a different Medicare Advantage plan. And if your eyes are already glazing over with enrollment periods, again, OSHIP can kind of sort that out for you based on your individual needs. And certainly, if something unique changes with your circumstances, you're moving, your plan drops you, contact us, because you typically do have a special enrollment period with protections that those of us not on Medicare wouldn't have.
And I say that to our volunteers too. All those enrollment periods can be very complicated, so it's better to have somebody else figure that out for you rather than you trying to interpret it on your own. I'm going to do one last question, and then I want you to do a review of how they can find our Welcome to Medicare events and everything. And so somebody asked, you mentioned COBRA, that we know that COBRA is not creditable coverage because you're not actively working. What about if I'm on the marketplace? I have an Affordable Care Act plan.
Oh, thank you. Yeah, so if you're on the marketplace prior to being eligible for Medicare, your marketplace plan should notify you when you're becoming eligible for Medicare that you need to make that switch. So same thing, that marketplace plan should go away when you're 65 and on Medicare. If you're not collecting Social Security benefits, you need to apply socialsecurity.gov for the A and the B and transition from the marketplace to Medicare.
Okay, so can you, you're right, exactly. Review again how our Welcome to Medicare events are going to work, both our in-person and virtual, and how people can find more information.
Yeah, so the easy thing, you've always got our hotline folks there to assist you. But here on this very last slide, which if you downloaded the presentation, you'll have this information. It's also everything you can find on our website, insurance.ohio.gov. So if you're interested in going to one of our local events, call our hotline or go to our website. And what I usually do is search for welcome. There's a listing of all of our in-person events. If you are turning 65, you may very well receive a postcard invitation to these events. An in-person event is going to run a lot like what we did today. It's going to just have one of our OSHIP presenters going over the two different options and things you need to take into account when you are new to Medicare. They'll go into a little bit more depth about the supplement plans and the Advantage plans and the options, and certainly allow time for Q&A while you're there in person. If you're unable to attend one of our in-person events, or you just can't make it on that night, we are going to be offering a lot of webinars, which you can sign up for on insurance.ohio.gov. There is a registration link. And really hear kind of the same presentation again, but again, with a little more detail on those options and basis there. I encourage folks, get on as many of those webinars as you'd like. Sometimes hearing it from a different presenter allows you to learn it just a little bit differently. And I know even myself, I pick up something different every time I hear the Medicare presentations. Also, you can have your individual questions answered by setting up Counseling, there's a direct link there, but that of course is also on our website, insurance.ohio.gov. And we use Microsoft Teams as the platform, but you'll be face to face with one of our OSHIP staff, providing answers to your questions one-on-one, or handling the comparisons for prescription drug plans, advantage plans, or supplement plans. So there's a lot of resources available to you. I highly encourage you to take advantage of our program to provide objective and unbiased information. Get that knowledge base before you talk to the plans or the agents directly.
And we failed to mention our volunteers.
Oh, thank you. Yeah, OSHIP. I should say every state, every U.S. territory has a SHIP. We're funded by federal grant dollars to provide this objective information. In Ohio, we're very fortunate. We sit within the Department of Insurance, so we're very close to the pulse of the regulatory agency. But we couldn't do this alone. Ohio has about 2.4 million Medicare beneficiaries, and each year we serve hundreds of thousands. And that is because we have local volunteers. Over 500 individuals across the state of Ohio have gone through a comprehensive certification training to be the local face of OSHIP. So in many cases, we're starting to see things open back up. There is a local individual that will sit down and talk with you as well. Our volunteers are the backbone of our program. They're amazing. You can probably tell by the way Becky and I are speaking of them. But we couldn't reach the amount of folks that we do without our volunteers.
Great. And lots of great comments. I think people have gotten a lot out of today. I hope you join us again for another webinar.
Right. I greatly appreciate folks' attendance today. As I said, this was kind of a high level touch on all the topics, and there's a lot of topics to touch on. So please, once again, I would just encourage everyone, take advantage of the resources, the additional webinars, the in-person or the one-on-one counseling opportunities. Thank you so much for your attendance today, and we're happy to be here for you.